Welcome to aminacademy.com in psychological abnormality, and that we'll discuss about psychopathology. Psychopathology is the scientific exploration of abnormal mental states that, for more than a century, has provided a gestalt for psychotic disorders and guided clinical as well as scientific progress in modern psychiatry. In the wake of immense technical advances, however, psychopathology has been increasingly marginalized by neurobiological, genetic, and neuropsychological research. This ongoing erosion of psychiatric phenomenology is further fostered by clinical casualness as well as preserved health care and research system. The skill to precisely and carefully assess psychopathology is in a qualified manner used to be a core attribute of mental health professionals. But today's curricula pay increasingly less attention to its training, thus blurring the border between pathology and variants of the normal further. Despite all prophecies that psychopathology was doomed, and with neurobiological parameters having yet to show their differential diagnostic superiority and value for differential indication, psychotic diagnosis continue to rely exclusively on psychopathology. Now, we'll discuss further detail about psychopathology. So, psychological abnormality refers to pattern of thinking, feeling, and behaving that deviate from typical standards, while psychopathology is the scientific study of these mental disorders and abnormalities. Psychopathology aims to understand the symptoms, causes, that is, etiology, progression, assessment, diagnosis, and treatment of these conditions. The term also refers to the manifestation or symptoms of psychological disorders themselves. What psychopathology studies? Symptoms and behaviors. Pathology examines abnormal cognition, maladaptive behaviors such as self-harm, unhealthy eating pattern, or damaging relationship and distressing feelings. Etiology. It investigates the causes of psychological disorders, which can include biological, genetic, environmental, and social factors. Diagnosis and treatment. The key goal is to reliably predict, explain, diagnose, and treat these disorders. Psychopathology diagnosis involves evaluating a person's thoughts, feelings, and behaviors against criteria in a systems like the DSM-5 TR and can include physical exams and neuropsychological tests. Treatment combines psychotherapy like CBT, medications, depressants, antipsychotics, lifestyle changes, support group, and advanced therapies such as ECT for severe cases. The specific approach is tailored to the individual's diagnosis, symptoms, and circumstances, often requiring a collaborative care team. Defining abnormality. Defining what constitutes psychological abnormality can be challenging, but it generally involves a combination of factors. Deviance, that is, thoughts, feelings, or behaviors that violate social norms or expectation. Distress, emotional or psychological suffering experienced by the individual. Dysfunctions, maladaptive behaviors that interfere with a person's daily functions. Danger, behaviors that pose a risk of harm to oneself or others. Why psychopathology is important? Identification of issues. It provides the framework for mental health professionals to assess an individual's mental states. Guidance for treatment. Understanding the mechanisms of psychological disorders helps in developing effective treatment strategies. Distinguishing from normalcy, it helps differentiate true psychological disorders from normal variations in human experience. So far, we discussed about the psychopathology. We have done. Please subscribe our YouTube channel.